Every year, tens of thousands of nursing home residents face serious injuries from abuse or neglect in the very facilities that are supposed to care for them. Nursing home injuries are especially serious because they can take much longer to heal in older patients. They can also lead to more severe conditions like bone fractures and infections, and even be fatal. Of course, nursing home injuries can result from accidents that may happen during daily activities, but they often are the result of abuse or neglect by staff caretakers. So it's important to know what to look for to help better protect your loved ones. Common nursing home injuries fall under 10 main categories. Since nursing home residents might spend a lot of time in bed with little to no movement, bed sores can happen when that lack of movement leads to excess pressure on the skin. Bed sores can be very painful. In severe cases, they can even become infected. If left untreated, they can become extremely painful ulcers, resulting in cancer or sepsis. Nursing home patients are at high risk for slips and falls due to poor balance or vision loss. They may also lose their footing on wet surfaces. These can all result in dangerous broken bones and fractures that may not heal properly due to the age and physical condition of the patient. Dehydration and malnutrition due to lack of proper food and fluids can lead to unintentional weight loss, infections, confusion, and a weak immune system. Unfortunately, nearly 40% of nursing home residents are malnourished and dehydrated. Asphyxiation can occur when patients don't receive enough airflow to breathe properly. It requires immediate medical attention and care, as it can result in brain injury or death. Infections can be common at nursing homes, as many of their patients suffer from weakened immune systems. These patients are more vulnerable to urinary tract infections, skin infections, respiratory infections, influenza, and soft tissue infections. An estimated 2 million infections occur in U.S. nursing homes annually. Head injuries can be caused by physical abuse or neglect, especially from slips and falls. They are far too common and often dangerous because they can result in severe brain damage or even death without immediate medical attention. Bruises and skin tears can be prevalent in nursing homes caused by physical abuse or neglect. These injuries include bed sores or infection if a patient's skin is exposed to moisture for too long. Some cases can even be caused by poor hygiene, balance, or vision. Minor cuts can happen regardless of whether the nursing home staff is adequate or not. These cuts and lacerations need to be cleaned and treated by a doctor right away to reduce the risk of infection. Welts, which are more severe than cuts or bruises, may result in infection and require close monitoring by a doctor. Some welts might require stitches if they don't heal properly on their own. Elderly patients can easily suffer from spinal injuries, especially after a fall. This can lead to respiratory issues, partial or total loss of feeling, paralysis of arms and other body parts, pneumonia, and even death. The rate of these types of injuries in nursing homes, often resulting from abuse and neglect, has been on the increase. According to the National Council on Aging, an estimated 5 million people are affected by elderly abuse every year. During the COVID-19 pandemic, the numbers have grown even more significantly. As many countries experience a rapidly aging population, elderly abuse that leads to injuries is expected to increase. Elderly abuse prevalence in community settings, such as nursing homes, is reported to be as high as 15.7%. The nursing home or residential care facility is typically responsible for any harm done to its patients. Preventing these types of nursing home injuries is possible and necessary to ensure the health and well-being of the residents. That makes it crucial to stay as involved as possible with your loved one's care. Visit the nursing home often and constantly talk with the patient. Ask the nursing home staff questions about the residents' day-to-day activities and behavior. This information can provide helpful insight and better identify behavior changes that may indicate abuse, neglect, or injuries. Your attention can go a long way in keeping a resident safe. If you become aware of a senior who has been injured in a nursing home, there are 3 ways that you can take action. The first thing to do is ask for a thorough investigation from an adult protective service agency. Second, you can contact the police and press charges. Finally, you can take civil action by pursuing an abuse or neglect lawsuit. Do not be afraid to share your story or ask questions. As the older population continues to grow, it becomes even more important to raise more awareness of elderly abuse and make sure that nursing homes and facilities live up to the expectations of the residents and their families. For more information about elderly abuse, contact us today. If you believe a family member was injured due to elder abuse, maltreatment, or neglect in a nursing home, contact us for a free case evaluation. nursinghomeabuse.org, exposing nursing home abuse and helping seniors get justice.